Welcome to our All About Diabetes. Today's presentation will be about the most important vitamins for diabetic patients. The content of these presentations is based on studies published in medical journals. In no case is it recommended to stop the treatment indicated by your personal medical doctor. The main vitamins with an important role in diabetes are vitamin C, vitamin D, vitamin E and vitamin K. We will start with vitamin C. The roles of vitamin C are: lowers glycemia, increases iron absorption, inhibits histamine release, improves periodontal disease, stimulates the immune system, and it is a good antioxidant. Also, it is extremely sensible if boiled, 50% being destroyed. Here you can see a table with recommended daily intakes of vitamin C. For adults after the age of 19, it is recommended to add 90 mg per day for males and 75 mg per day for females. Good dietary sources include peppers, broccoli and cabbage. Vitamin D is very important for diabetic patients. Vitamin D or calciferol forms are D2, known as ergocalciferol, which is found in plants as a product from ultraviolet B radiation on ergosterol. D3, which originates as dehydrocholesterol produced by ultraviolet B radiations. Vitamin D deficiency represents a high risk for diabetes, cardiovascular mortality, autoimmune diseases like autoimmune thyroiditis, Alzheimer's disease, colorectal and breast cancers. Dietary vitamin D3 sources are synthesis in the human epidermis after sun exposure, fish oil, and egg yolk. The roles of vitamin D are calcium absorption, stimulation of pancreatic beta cells to secrete insulin, stimulates the immune system, has a good effect on the inflammatory response, is involved in muscle function. For adults after the age of 19, it is recommended to add between 600 and 800 units per day. Good dietary sources include cod liver oil and salmon. Vitamin E has two forms, tocopherols and tocotrienols. Vitamin E has been found decreased in patients with diabetes. High concentrations of alpha-tocopherol have been associated with decreased risk of diabetes. Vitamin E sources are vegetable oils, seeds, nuts. It is very important to know that medications such as orlistat decrease vitamin E absorption. The roles of vitamin E are antioxidant, activity of microsomal enzymes and protein kinase, induction of apoptosis in tumoral cells, inhibition of platelet aggregation, cell membrane stability, erythrocyte formation, insulin resistance and glycemic control, modulation of the immune system. Usual dietary intakes are 7-11 mg per day. Also, natural vitamin E has twice the bioactivity of synthetic forms of the vitamin. Vitamin K has two forms, phylloquinin and minaquinins. Minaquinins influences insulin sensitivity and glucose metabolism. A lower risk for diabetes mellitus was observed with increased vitamin K intakes, especially with minaquinins. Vitamin K daily intake recommended for adults over 19 are, for men 120 micrograms per day, and for women 90 micrograms per day. Good dietary sources include kale, spinach, dandelion. Thank you very much for your attention. I hope you enjoyed the presentation. Please like and subscribe.